I, Drushti Pandya.
And I, Priyanka Vish.
Will be your host for the day. We are gathered here to exchange ideas and open discussion on innovation in healthcare. We look forward to a stimulating and fruitful discussion with you and our esteemed audience.
Alright folks, so let's cut to the chase. You must be thinking that why we are all huddled up here today to talk about healthcare innovation, right? Well, it's not just a random thing. It's the name of the game. Innovation is not just a buzzword. It is a boost for growth, the secret sauce for off-the-charts productivity, the magic wand that waves away those head-stretching problems that keep us all on our toes. In a world where every industry is riding the innovation wave and surfing the tech tide, healthcare is still finding its groove. It's not just about flashy breakthroughs. It's about making sure these breakthroughs don't just sit on a shelf collecting dust, but actually changes lives. And today, my friends, you are in for a treat. We have got a lineup of experts, each with their own unique spin on things. We welcome you all to the brainstorming bonanza and collaborative approach aimed at a better tomorrow. So buckle up, because the panel is about to take you on an insightful ride into the future of healthcare innovation.
I'm delighted to invite Dr. Preeti Pradhan, the chair of this panel, on the dais. Dr. Preeti has done his master's in healthcare management from Tata Institute of Social Science, Mumbai, and PhD in healthcare innovation and strategy. He has 25 plus years of experience in healthcare ecosystem management and academia. He has also pursued mid-career course in management of international public health from Emory University, USA, to keep himself abreast with global health management arena. He has served in a variety of national and international healthcare organizations of repute and acquired knowledge and skills with intense and dedicated learning motive of job. With his length and breadth of experiences and exposures, he is now an expert advisor and mentor to academias engaged in healthcare-related courses, building healthcare human resources and social enterprises in healthcare. He is passionate teacher, trainer in healthcare management, public health, digital health management areas. Besides exposure to all the regions of India, he has experience working in 25 countries of Asia and Africa.
We welcome you, sir. Okay, so allow me to present the moderator for today's panel discussion, Professor Dilip Mavlankar. Professor Mavlankar is a distinguished professor of public health and former director of Indian Institute of Public Health, Gandhinagar. He holds an MBBS and MD in community medicine from Gujarat University, and MPH and DRPH from Johns Hopkins University, USA. With a rich professional history, he has contributed as a faculty and researcher in esteemed national and international institutes. Professor Mavlankar has served as a consultant to various prestigious agencies such as Columbia University, Mother Care Project, WHO, UNICEF, Danida, UNDP, World Bank, and SEDBA. Professor Mavlankar has achieved various honors and rewards, including Paul Harper Award 1990, Johns Hopkins School of Hygiene and Public Health, Baltimore, USA. Hewlett Foundation Fellowship for doing Doctor of Public Health at Department of Population Dynamics, Johns Hopkins School of Hygiene and Public Health, 1984. Nominated to the membership of Alpha Chapter of Delta Omega, the Honorary Public Health Society, USA, 1983. The National Science Talent Award, NCERT, New Delhi, 1975. Professor Mavlankar was appointed by the Prime Minister of India to the high-level missions steering group of the National Rural Health Mission constituted by the Government of India in 2025. He is a chair of the Technical Working Group on Maternal Health by the Government of India. He is also a member of the Steering Group on Health for the 12th Five-Year Plan of the Planning Commission of India. We welcome you, sir, on the dais.
Our next panelist is Ms. Ritu Balya. She is currently working as Engagement Manager at Health Arc Insights. Ms. Ritu is a B.Pharm and an MBA from Symbiosis University and has over 8+ years of experience experience in managing consulting. She specializes in secondary and primary research and has deep expertise in pharma and healthcare sector.
We welcome you, ma'am, on the dais. Let's move towards our next panelist, Mr. Himanshu Sharma. Mr. Sharma is a seasoned professional specializing in healthcare business development with a focus on medical value travel and customer-oriented outcomes. He has spent over 20 years in the healthcare fraternity, worked with institutions like ACIES Hospital, Narayana Health, and Apollo Hospital. We welcome you, sir, on the dais.
Our next panelist is Mr. Santosh Kumar. He is currently leading Lipomic Medical as National Sales Manager. He has 17 plus years of experience in healthcare business development. He holds an MBA in Marketing from MD University Rohtak and an MS in Biotechnology from CCS University, Meerut. We welcome you, sir.
So let's call on the dais the last panelist for today's panel discussion, Dr. Harsh Shah. Dr. Shah currently serves as a faculty at Indian Institute of Public Health, Gandhinagar. He earlier worked as a senior consultant for National Health Mission at the Health and Family Welfare Department, Government of Gujarat. Dr. Shah has a keen interest in the field of tuberculosis and digital health and had been instrumental in developing the M Health tool, Nikshay Setu, used by healthcare workers across India. We welcome you, sir.
Now I would like to invite our chair of the day to give their opening remarks for the panel.
Hello one and all. Respected panel members and my esteemed audience. I think we are lucky to have listeners here. And as I understand, most are students, so hopefully this will be a good learning. So my job is to set the tone of this session. Primarily, innovation as a topic, we normally don't study, we take it for granted. Innovation, we use this word, English word, a lot. But it has a very simple dictionary meaning. I'm sure those who will Google will find it, be it Collins Dictionary, be it Oxford, be it Cambridge, whatever dictionary you use. What does innovation means? In the simpler sense, it says, an innovation is a new thing or a new method of doing something. An innovation is a new thing, completely new, or a new method of doing something. And for me, this conference ambience is something which is a new method actually. In my professional career of 30 years, I have never attended an open air conference. So this is innovation. In case you want to understand in a very simpler sense, this is also innovation. And I was amazed to see this. I don't know how many of other members, other experts here have attended a conference in the open air theater like this, in the daytime that too. So this is precisely what is innovation. For the student's interest, there is something called, if you have ever done any innovation or patent, you would realize there is something called utility patent. There is something called design patent, two types of patents in the innovation framework. And utility patent, if you look at the dictionary meaning here of innovation, the utility patent is about developing something new which is not existing. And the design patent is about new method of doing conference like this. Let's say you have designed it in a different way. That's called design patent. And my humble submission to all the audience, especially the students, you have huge opportunity today to have patents in your name. very easy in our day-to-day life, in our social life, in our way of doing something for the community, society, country, state. We can innovate lots. And when you innovate something, which is a new method of doing something which is existing, that becomes your design patent innovation. And you can register it as a patent in your name. Not very expensive, very cheap to do. Patent lawyers will do it for you. But the idea has to be yours. Utility patents are a little difficult and little expensive, but at least start with design patent as innovation. All of us can do it. And I'll give a simple example. I met this gentleman who has done this design patent of perfume bottles. Now he's doing many innovations, but then he started like this. He said, I was roaming around in Indian airports. I found these perfume shops in the Indian airports. He had time to catch the flight, so he said, who normally gives perfume as gift? Either husband to wife, wife to husband, or lover to be loved. Those kind of. He said, why can't I do something like this? Pack those perfumes in alphabetical letters bottles. S, J, P, K. The bottle design will be in that letter design. And he patented it. He is the patent holder of perfumes packed in alphabets. So this is as simple as that. The point what I'm trying to tell is as simple as that for doing a design patent in your name. So please try it. So before getting into a small video, let me also give some more clarity on the concepts. There is something called disruptive innovation. And what it says innovations that make expensive products and services more affordable and accessible. That becomes disruptive innovation. You may innovate something which is not useful for the common man. That can be a disruptive innovation. It may be a wonderful thing for the rich and mighty and few people. If it is not helping the mass, we cannot call it as a disruptive innovation. Harvard professor has designed or coined that concept. We'll see the video. The other thing is about health innovation, which WHO defines as new or improved solution with the transformative ability to accelerate positive health impact, is the WHO definition of health innovation. Going to little further, I'm not quoting any examples of what are the health innovations. During the panel we'll discuss, as moderators I will do that. But coming to the innovation key cultural concepts, how innovation happens in an institution like this, or any institution, any organization. There is a concept called psychological safety. Very, very interesting and very important. Innovation, it says, the researcher who developed this concept, he says, innovation flourishes when people on a team openly debate and disagree. The question is, how to get them to speak their minds, particularly when it means challenging their leaders or acknowledged experts. Some management experts argue that the best way to get people to speak is to create psychological safety first, which is an atmosphere where people feel accepted, comfortable, sharing concerns and mistakes without fear of embarrassment and retribution. That's critical. For any institution, any human being, be it in your family, you want your children to be creative, innovative. This is the fundamental concept, which is psychological safety. And there is one more concept, which is about intellectual honesty in innovation. And what is that? Intellectual honesty is applied method of problem solving characterized by unbiased, honest attitude, which can be demonstrated in a number of different ways. One is facts should be presented in an unbiased manner and not twisted to give misleading impressions or to support one view over the other. References, earlier work are acknowledged wherever possible and plagiarism is avoided completely. For individuals, research integrity is an aspect of moral character and experience. And these all comprises the intellectual honesty, psychological safety and intellectual honesty, two critical components of innovation. I'll not go further in my presentation. I'll directly get into the video, which will give you the perspectives of what I just said. Thank you.
What is innovation? Life is made up of dots. Many, in fact most people, believe that the dots they see every day are all the dots there are. So life goes along according to these known dots. Decisions and solutions are based on these commonly known dots, as well as many conclusions too. Some companies build their entire businesses on these known dots. This we know as the status quo, business as usual. Then one day, someone comes along and sees one or more dots beyond the commonly agreed upon dots. Dots that others miss, dots that are ignored, dots that others have long since forgotten about. Some like these new dots and celebrate this new discovery, liking how things currently are and comfortable with everyday dots. Some protest these new dots. Some even claim they aren't valid, or worse, are imaginary dots that don't even exist. Yet, it's these new dots that potentially change everything. What is the source of these new dots? Notions, unexpected connections, ideas, possibilities, and imagination. Fire was one of these dots. So was the wheel, and the bicycle, and the automobile, and the computer, as well as the internet, the smartphone, and the tablet. In fact, many of today's common dots were at one time uncommon, newly introduced dots. So what is innovation? Those other dots, the ones others miss, and having the certainty to know that the dots you see are not only valid, but necessary if the world is to move forward.
Hello, I'm Des Dillon. Welcome to The Idea. My guest today is Professor Clayton Christensen. Clay, welcome.
Oh, thanks, Des.
What exactly is disruptive innovation? Explain it.
A disruptive innovation is not a breakthrough innovation that makes good products a lot better. It has a very specific definition, and that is it transforms a product that historically was so expensive and complicated that only a few people with a lot of money and a lot of skill had access to it. The disruptive innovation makes it so much more affordable and accessible that a much larger population have access to.
So, give us an example of this. I mean, most people are familiar with the computer industry and how that's developed. Perhaps you can use that as an example.
Yeah, so at the beginning, the first manifestation of digital technology was a mainframe computer. It cost several $1 million to buy, and it took years to be trained to operate these things. And so that meant that the largest corporations and the largest universities could have one. You know? And so we had to take our problem to the center where the experts solved it for us. But then there's a sequence of innovations from the mainframe to a mini, to a desktop, to a laptop, and now to a smartphone that has democratized technology to the point that everybody has access to it around the world. And we are much better off. It was very hard, though, for the pioneers of the industry to catch these new waves. Most of those were created and dominated by new companies.
And I mean, you're touching on that gives rise to, this process gives rise to the innovator's dilemma, which was the title of your 1997 book.
Yeah, that's right.
But how do people get around that? I mean, that dilemma, can you explain the dilemma itself to us?
Yeah, so the dilemma is, in every company, every day, every year, people are going into senior management, knocking on the door saying, I got a new product for us. And some of those entail making better products that you can sell for higher prices to your best customers. A disruptive innovation generally has to cause you to go after new markets, people who aren't your customers. And the product that you want to sell them is something that is just so much more affordable and simple that your current customers can't buy it, you know. And so the choice that you have to make is, should we make better products that we can sell for better profits to our best customers? Or maybe we ought to make worse products that none of our customers would buy, that would ruin our margins. What should we do? And that really is the dilemma. It was the dilemma that General Motors and Ford faced when they tried to decide, should we go down and compete against Toyota, who came in at the bottom? Or should we make even bigger SUVs for even bigger people? And now Toyota has the same problem. As the Koreans in Hyundai and Kia have really won the low end of the market from Toyota. And it's not because Toyota's asleep at the switch. But why would they ever invest to defend the lowest profit part of their market, which is the subcompacts, when they have the privilege of competing against Mercedes? And then Chery is coming from China, doing the same thing to the Koreans.
So one of the things I really like about your ideas is that they really do have had an impact out there. I mean, some of this thinking has, without question, influenced a whole generation of managers, including people like Steve Jobs. You're referenced in your biography that he read the book and was very influenced by the book, and possibly Apple I and Apple II are, you know, him resolving the innovator's dilemma.
Yeah.
But also Andy Grove at Intel. You had a contact with him.
Yeah. It's I never imagined that I could ever meet these people, you know, let alone be just as having helped them. But I learned a lot from Andy Grove. So what happened was I was just at HBS minding my own business, and Andy Grove called me just out of the blue and said, look, I'm a busy man, I don't have time to read dribble from academics, you know, but somebody told me you had this theory, and I wondered if you could come out and present what you're learning to me and my staff, and then tell us how it applies to Intel. And for me, it was a chance of a lifetime. So I flew out there, and turned out he's quite a gruff man. He said, you know, stuff's happening to us, but we only have 10 minutes for it. So just tell us what it means for Intel. And I said, Andy, I can't because I have no opinion about Intel, but the theory has an opinion. And so I have to describe the theory. So he sat back impatiently, and 10 minutes into it, he chucked me off and he said, look, I got your stupid theory. Tell us what it means for Intel. And he got what he got, and he really did get it. You know? And I said, Andy, I need 5 more minutes, because I got to describe how this process of disruption worked its way through a totally different industry, just so you can visualize what can happen.
So in the interest of time, you all can see this, it's there in the YouTube. Those who want more to understand. The only two simple things I want to tell because a lot of students are here. They have a long way to go in their life and career, and they should be the innovators actually. There are many innovations required in our society, especially in healthcare, public health, lots. How do you think about that? You say, okay, what is that today troubling a common man? What is that our rural population are not getting, which a city population getting it? What is that diagnosis or test or service or whatever which is needed, but our rural population are not getting it? Start from there. I'll give an example. So I was teaching in this healthcare management class, and then one student asked me, sir, why a lot of women in India have thyroid problem? What can we do for it? I said, yes, thyroid problem, but thyroid problem has solutions. They can go to a doctor or a hospital and... But she said, how do they know? How do they test whether they have thyroid problem in the rural areas without going to a hospital, which is the barrier? Then said, sir, I want to innovate something called thyrometer, a portable thyroid test, which people can keep like a thermometer in the home and do that testing, or in a village they can keep one, maybe. So that was the idea. That student has nothing to do. She was not a biochemistry person or anything who can really. But that thought itself, and you'll be surprised, that thought was registered as a patent, and it's registered as a thyrometer. And then she wanted to kind of partner with biochemistry people, doctors, similar marketing people and all that, and design that product to be available in the market. It's as simple as that, innovative thinking. So basically she started with a problem. This is the problem, how do I address it? And thyrometer emerged. So similarly, I was talking to a gynecologist sitting in the flight. That doctor, what are your common problems? Gynecology and obstetrics and all that. He just generally said, this is a management guy, you won't understand the clinical things. He said, in India, doctors give incision during delivery, normal delivery, random incisions. And that creates problem for the women at a later stage of life. Incontinence of urine and something he said. I said, can we solve it? It's very simple. Why so many years obstetricians are waiting for it? Then he said, yes, we can design something called perineal retractor, like a device which will exactly give the measurement. And sitting in that aeroplane, we applied for patent, we have got it. Perineal retractor. And now we have asked an engineering company to design that thing. This is such a small device, very, very basic. But because this is not there, today a lot of obstetricians, young, those are not very experienced, they randomly do the incision, and that results in a lot of post-delivery complications and all that, as I understand. So as simple as this, think of a problem, start thinking of a solution, then immediately patent it in your name. So this is what I wanted to say. Thank you very much.
Thank you very much, Dr. Kirti. I think he has given us enough thought, enough material to think about. I was just thinking, I took his advice just last 6 months ago and applied for my first patent. I had a neck pain because sitting on the computer for a long time, and my orthopedic friend advised that you keep this type of pillow under the neck, etc. So I designed for myself a neck pillow, looking at the neck physiology and how do we sleep. And I felt, I got it made, I've used it for 6 months, I felt it better. Then I said, why don't I patent it? So I've now applied for my patent. So his advice, if I had got before when I was young, I would have maybe 100 patents by now. So I think it is a matter of thinking and solving the problems, which you think are very simple problems which day to day keep on coming, and that is how many innovations in the past have happened. I will not take much because we have a very esteemed panel. I will go to the panel, but his message is that anybody who thinks differently, who thinks what is called as laterally. I will not explain what lateral thinking is. Think about that and look at the problem, and if you can solve the problem, you may be able to create a better world. Now, some patents earn you money, other patents don't earn money but create a better world. And I'll just give you one example and stop. When the PC came, IBM was the first innovator to develop the PC. This was 1980s. They could have patented it, but they decided that it is so important that they kept it open without patent, what is called an open innovation. And that is why today hundreds of companies are able to make PCs in a very innovative way, in a low-cost way. And finally, IBM had to close down its PC business because the other people were so good. Of course, IBM is still there, but they lost their PC business. So in some sense, and Indian pharmaceutical companies have done this n number of times. Recently, I don't remember which drug, from some 10 lakh cost, it has come down to some 6,000 rupees cost per month. So we have many examples where innovations done by Indian companies have brought down the drug cost. Similarly, treatment cost. So India, in some sense, is a hotbed of innovations, and people like you would be the people who would do the next level of innovation. So let me start with Madam Ritu to ask her what she feels is innovation and what factors contribute to India's potential to become a world leader in innovative healthcare, because we are talking about healthcare innovation. Madam.
So when we talk about innovation, I feel in healthcare, you can see innovation maybe in three parts or maybe in three components. One could be the product innovation, then there could be a process innovation and a paradigm innovation. Now, when I talk about product innovation, it is entirely, suppose, there's a new diagnostic tool. So sometime before mentioned about a thyrometer, right? A new diagnostic tool. It's completely a product innovation. Now, there can be process innovation wherein if we see, the delivery of medicines via drones. So there's already a technology, but we are, refining the process to make it happen. Medicine delivery by drones, or maybe if we say better satellite communications via telemedicine to enable care more timely and make it more accessible. And then there is something called as paradigm innovation, wherein, we are redefining the entire set benchmarks or entire set process. So, when Ayushman Bharat came in, it was one such paradigm innovation, because holistic universal health coverage India was talking about, but we weren't, able to achieve in that manner, as we are able to still, move at least in some manner towards it. Now, if I, look at India and see how India is such a hotbed for innovation, and why particularly in healthcare, India could be a very, one of the front runners. India is such a diverse population. We have, if we, create, like the government is already working on it, if we create genome banks, we will have such a rich genome bank which we won't get any other place in the world. So we have a diverse population. There are a lot of young minds. We have a young population who are doing a lot of innovations. A lot of small things. Maybe they don't get patented, or maybe they falter back somewhere around scaling stages or maybe some other stages. But if we look around and start thinking, we will see a lot of small innovations here and there. And India absolutely has, a great potential to do even a lot more, because a lot of times these innovations are happening in silos. Once, if it happens in more accelerated pace and it happens in more proper channels and at more proper formal platforms, we can accelerate more and have a much better future in that.
Thank you, madam. Now I go to Himanshu Bhai. Himanshu Bhai, you are passionate about patient-centric approach. So normally when people think of innovation, they think of technology, smartphone, smart watch, smart something. But finally, patient needs empathetic care. Patients are not products which are standardized. Each disease is different. Each patient of the same disease may be different. So how and what kind of innovations in healthcare can make healthcare more patient-friendly and with compassion?
Sure. First of all, a very good afternoon to all of you. And definitely, as Kirti sir mentioned, this is a brilliant innovation that I have also seen for the first time, being in an open air conference. So thank you very much. Coming to the question that sir has put to me. Now, I think everybody would agree to the fact that when we go to a hospital or a doctor, the first point or the reason for going is pain. Right? When we go to a healthcare system, when we go to a healthcare professional, the whole imperative revolves around pain. Now, that pain, even before obviously there are blood reports and other things which are done, because we start usually with a blood report, right? Now, when we are starting with, you have pain and you are going to a phlebotomist for collection of your blood, and the phlebotomist has to prick you 2, 3, 4 times, right? If you are healthier, it can be more. If it's a cancer patient, it can be even more difficult. If you are a kid, it becomes even more challenging. So, pain is our reason for approaching to a healthcare facility. Our healthcare facilities should be designed so that the pain is not increased. It is controlled or it is managed. Now, what do we do that? Because prick, obviously I'm sure everybody around here is scared of a prick, right? Anyone who says that I'm not would be lying, because I am, and I'm sure everybody else is. So when we talk about a simple thing as vein, we have got these vein enablers wherein you are able to monitor and clearly see vein finder machines. It's a very simple thing. It's an innovation that has been there for a while, but not widely accepted. Right? Even when I'm basically a business development guy, now I always look at the fact that when you are promoting your hospital or clinic or healthcare facility, you talk big things about technology. We don't talk about small enablers which will actually address the smaller aspects of pain for a patient. Now coming to the people aspect, because that's been my core area of interest. Patient counseling is something which doesn't go with a lot of business development people, but I believe that is something which is the future and it should be looked into that. When you are trying to talk to your patients about a certain treatment, obviously cost is definitely an inhibitor. But having said so, if you are able to create an environment of comfort, if you are able to create an environment of promise around them, that is an innovation which hospitals lack today. Right? Most of it would operate on a fear. Okay, let me give an example. I don't want to make my conversation boring with you guys. So, when we go for a movie, or you go to a stand-up show, right? Stand-up comedy, the end result is that you have an emotional connect. You would like to benefit emotionally from it. You want to feel happy. You want to feel interested in something new. You are not going there to learn something great about life, right? So, when our whole focus is when we are going to seek entertainment and emotional support, it could be it could be a movie theater, it could be a stand-up show. If it is not able to deliver that to us, means it is not equating our emotional expectations. Same is true with a hospital also, though it might sound funny, but that's a fact. When we go to a hospital, we are going there in pain, we are going there in trauma, we are going there with some amount of, anxiety. If we are not able to address that, that is something which the whole purpose is defeated. So, patient care systems should ideally be, devised and confirmed around the patient. We all talk about patient centricities in hospitals, but we are not really driving that focus. So there is a need for people could be using technology for it. Like when you are counseling somebody in emergency these days, it's mandatory that you need to have recording done so that, in case there is a death or morbidity, you know that everything has been explained. But the passion that is required, so any innovation is not an innovation till it is bound by passion. So anything we can do, even if you want to make money out of it, if there is no passion to drive it, it's not going to be there. So that's my submission, sir, that if anything that we do around should be passionate.
Thank you. I move to we have seen COVID emerge over last few years, and before that MERS and other infectious diseases which will keep on coming. So what do you think is the challenges of these infectious diseases, and how can we address them through leveraging various technologies?
So good afternoon everybody. Indian healthcare infrastructure is under a constant stress. Ever-growing population is a reason that it is under constant stress and strain. And unforeseen situations like COVID-19, when we face this kind of situation, this shortage is even more critical. People are there who are not able to achieve, who are not able to get the basic facilities. So in that situation, the innovation becomes much more important to provide the basic healthcare facilities to the common people. Like the situation was very worse, but the small innovations like the home testing kits for the COVID, mini oxygen concentrator, portable ventilators, home visit for the radiography and radiology X-ray. All these small innovations help to control the situation. The burden which otherwise would have gone to the hospitals was taken care at the home, and the isolation was made easy. Giving the basic support was made easy. So that is where the innovation actually helps. And not only in the case of pandemic situation, but also in the case of long-standing disease like tuberculosis. The government is leading so many programs, but still we are not achieving the desired goal. So a lot more innovation is required so that we can reach to the common people. And innovation can help us that with the help of the making the technology more portable, more easily accessible, more economic, we can reach to the common people, we can reach to the primary healthcare centers, to the villages. So for that, innovation is required. And innovation can help that whatever centers are there available, we can make them more enabled, more empowered, and they can start serving in a more impactful manner. So we can be ready with the portable devices, be it X-ray, be it portable oxygen concentrator, be it portable ventilators, so that if there is a situation of pandemic, we are more prepared. So that's what I would like to say.
Thank you. Thank you. There is a saying, आपने प्राइम मिनिस्टर को भी सुना होगा, आपदा में अवसर. So even COVID, which was a major catastrophe throughout the world, I wrote a small article, 19 benefits of COVID-19, and at the end I will count, it is available and published. For example, teaching online was prohibited by UGC. You can't teach online. Now COVID came, UGC had no other go saying you can't teach online. I used to struggle with Ministry of Health saying, can we do video conferencing, because for 1 hour meeting they will call everybody from Chennai, Tamil Nadu and Ahmedabad and everybody, and we get 5 minutes to open our mouth, spend whole day. They had video camera in Ministry of Health. Every time they promised, next time sir meeting में ये कार चालू कर देंगे, वो कभी चालू नहीं हुआ. But जैसे COVID आया तो सब online हो गया. So we had the technology. And on a lighter side, I'll leave you with a question. Many of you are women, so don't get embarrassed, but the question is, before Second World War, the swimsuit for women were full from shoulder to the knee length. So how did bikini arrive After Second World War, bikini arrived. And the reason for development of bikini was that there was shortage of cloth in the Second World War. Because of war effort, there was so much of rationing of everything. Cloth was also in shortage. So that's why designer developed the bikini. So moving ahead to Harsh, I want to ask him, he has been working on digital health and artificial intelligence and development on that front. So what kind of innovations have you seen on the digital front and AI and the new tools of digital technology for healthcare use?
Good afternoon, everyone. So most of the students are in the audience section. So there are a couple of innovations are there. One of the innovations, two of the innovations you have seen in the stalls. That one is the X-ray identification through the AI, and second is the handheld X-ray devices. There are many innovations are coming in the form of digital health and artificial intelligence. In the morning sessions, there are a couple of discussions going on how to make a more innovative and more patient-centric AI healthcare innovations. During my experience of couple of last 3 years, I came across most of the times that diagnostic artificial intelligence tools, mostly on the imaging part. So if you go for the X-ray part, there are a couple of innovations on artificial intelligence space. The Big Tech is there, Cura is there, the NIC is also developing AI part onto the X-ray readings. There are other components as a student you would like to learn that if the X-ray is being read through the AI, some of the fundamentals of AI needs to be explored. So if I am a student, I should be aware that if the AI is going to read my X-ray or is AI is going to understand the X-ray, what kind of process that is being taken care to develop that model. So when we say about AI, most of the times we see about the ChatGPT. So ChatGPT जब भी बात करते हैं तब GPT का full form किसको पता है वो बहुत कम है. Same goes for the AI. If we talk about AI, most of the things that are in the market being considered as AI is not AI. So AI generated diagnostic, AI generated imaging still will need more evidences in the market. I've seen, when I was in Goa, there are Miramai. So those AI generated imaging part that are thermal sensing devices being placed at the breast. And the breast cancer is being suspected, not diagnosed, suspected through the AI. Second, if you know about Google Health, when I was in the southern India, the Shankara Eye Institute, many of you have understood the Shankara Eye Institute, so they had developed a diabetic retinopathy diagnosing tools through the AI. So they are not using in the main hospitals. They are using into the periphery assembly linings to diagnose the people who are having the diabetic retinopathy. And most of the AI innovations are being developed on the opportunities. So हमने पढ़ा होता है कि opportunity screening एक चीज़ होती है. Same way these innovation, probably after 5 years they would be the disruptive innovations, but these innovations would be disruptive innovations after 5 years. But still these AI is in the primitive stage, and we also need to understand how they are being developed as a student. That's my comments to the audience.
Thank you. We now come back to Ritu ji. She had mentioned about some innovations. So I want to ask her further that have you seen any innovations in the private sector and the government which is leveraging technology solutions to improve the quality and reach of healthcare and achieving some milestones which we would not have otherwise thought of.
Sure, sir, absolutely. So, yeah. So, innovations are happening in India, I would say all across the patient journey. Very interesting thing to witness. So if I talk about the patient journey, so it starts from prevention, right? There is some prevention, there's screening for diseases, there's diagnosis, there's treatment, and then there is the follow-up care and the monitoring, and in case of old patients or in case of the patients who are at the last stages, there's this palliative care and the rehab care, right? Now, there are innovation across this entire stage of patient journey. So if I talk about maybe, let's say, screening and diagnosis, right? There are several companies who are making this AI-based diagnostic tools. So there's a company called Cure.ai, which has developed a AI-powered diagnostic tool wherein it, runs scans for lung cancer. And there are 29 diseases, 29 related diseases to lungs which are getting screened for a patient. So what do? Is they detect specific deformities or specific deformities in the lung modules, which in a way indicate that that is a precursor for lung cancer or any other lung disease. Then there are a lot of this remote patient monitoring tools, which enables us, or the physicians as well as the patient, to get a 24/7 status around, okay, what's the blood pressure, what's the other metrics. And when I talk even about prevention, there are a lot of smart watches, there are a lot of fit bands, there are a lot of this app, that app that we do regularly track and use, right? All of these are also such tools, and when this tool started to arrive at the first time, they were innovations in itself. Now, if I talk about the treatment part, right, I don't know how many of you know this, but there are digital pills which are now coming in the market. So Proteus Digital Health was the company who manufactured it for the first time somewhere in around 2016, 2017, wherein, so this was specifically for patients with some neurological disorders, right? Wherein when the patient ingests that pill, it is also connected in the outside environment with a wearable app or a wearable sensor, and everything could be monitored. Okay, what are the changes in the body that is happening? The levels which has to be down, has it started reducing or not? All that kind of things. Now, a lot of use of this augmented reality and virtual reality is also being done, again in treatment for neurological disorders like depression, MTD, and others. The innovators have also are also been using and experimenting to use the use of gamification, again in neuro disorders, mental space. So if we look around, there are a lot of the small things and a lot of even big things going in and around. There is advent of robotic surgery in hospitals, which in a way saves time, is more accurate. Obviously it's expensive, but it is more accurate and is being opted by a certain group of patients. And if we talk about, if I talk about the last part, which is, kind of the monitoring is being done by remote patient monitoring apps and all of that. But if I talk about the rehab care and the palliative care also, a lot of innovations are being happening into that home-based care. So palliative care and rehab care, in India it is still home-based. In US it is more, there are specialized homes and rehab centers where the patients go and stay. In India, it's both. The home-based model is working more. But there also you will see a lot of innovation. Now the patients are not just, just on the bed and lying idle entire day. The physicians and the support team keep them engaging through gamification, through small activities and all of that. So there are a lot of, small things and a lot of big things which are happening in and around, and a lot of innovations. And a very interesting thing is that innovation is happening across the entire patient journey, across the entire value chain of delivering care. So that's very important.
Thank you. Now we again move to Himanshu Bhai. You mentioned about emotional aspects and patient-centric care, but you have worked in hospitals with very high technology. So what is your view on the newer technological innovations like this Da Vinci with Firefly mode and new things which are coming, which are high-end technology, and how will it benefit?
I would actually take it forward from where Ms. Ritu mentioned. I just pick up a point because, see, I'm just trying to link you guys to understand that how technology, emotional intelligence and innovations are required or useful for marketing a product. Because eventually, when we all go out, it is how a product or a service is marketed. The human element definitely is very important. When we talk about let's say I just take an example of robotics, as Ms. Ritu mentioned, I'll just take it from there. Like when we talk about robotics and we talk about rehab, people would be like, a robot would be making me do an exercise. It's not like that, right? For a layman, if I go out and I have a robotic rehab facility, which is separate for neuro, which is separate for ortho, which is separate for pediatrics. I mean, even understanding that would take probably 6 months to a common man. So a typical marketing person, and I'm sorry, I'm just merging the two so they get a bigger picture of the whole exercise. So if I'm going out in the market and trying to promote my facility or trying to say that, okay, I have a robotic rehab care and this is why it is better. What would I do is, I would note, I mean, typically that would happen to anyone, me or you, that we'll have a list of USPs, we'll go to people and say that, we are the best. I mean, that's what we are good at saying. So apparently in the scenario where we work in healthcare today in India, everybody is the best. So it's very difficult to choose who's the best. So what I say, we have to have a differentiator. So obviously there are so many people, there are so many hospitals which do robotic surgeries. What is your differentiator? The differentiator is decided by definitely the doctor, the management, and the people who are promoting it and the people who are into marketing. Now, coming back to how robotic rehab works, right? One is we have a list of USPs and we say that, if you have a neurological disorder, if you've suffered a stroke, and you are probably, at a grade 3 level wherein you need to do an intensive exercise. Now, what's going to do is you're going to go to a physical physiotherapist who's going to assist you. In robotic, obviously a physiotherapist is required. As your muscles start strengthening a bit, the robot itself increases the intensity. So that is basically the AI which is helping, which again we don't get into the details of understanding. Now coming to what Sir has put it across to me, now I have been a very keen observer of promoting robotics, especially while I was with Zydus. I was responsible for right from branding to brand promotion to brand conceptualization of the Da Vinci XI robotic system, what at that point of time was probably the most advanced around available in India. Now, one interesting thing what I came across is everybody was talking about lesser blood loss and smaller incisions, which somehow is not the case, sir, to be very honest. It is there true only for specific procedures, not for everything. The more interesting thing was I felt that when you're using a robot for complicated procedures like radical nephrectomy or prostatectomies, when you know that you have cancer cells around, cancer tissues around, and you have to preserve the healthy tissues, what do you do that? So I started asking these questions to the doctors. I attended close to 20-25 robotic surgeries across the fragment for me to understand that when I'm talking to people, when I'm counseling my patients for robotic surgery, I should have an idea what I'm talking, not as a person who's marketing. So this is one link for all of you who would ever get into business development. Business development is not about promoting a leaflet or promoting a product or promoting a service. Today in healthcare, it is promoting an experience which would only come with collaboration of your patient. So keeping this in mind, when I started attending surgeries, I realized that there are so many things which doctors don't talk about, which companies which are selling don't talk about. That is how I realize that if I'm going out and telling people that, hi, listen to us, when you are talking about robotic surgery, or if you opt for a robotic surgery, there is a great amount of chance that your surgeon would be able to identify a healthy tissue from a bad tissue or from a cancerous tissue right on the table. So your chances of a better, accurate surgery are higher. So what exactly is innovation doing here is, which is called ICG, which is a kind of special dye that is used during the robotic surgery. It differentiates just right on the table. Your surgeon is able to figure out that I'm not interfering with a healthy tissue. So the basic, again I come to the same thing what I started. The motive of healthcare is not to cause further pain, not to cause further damage. So all these small innovations are basically leading the way towards that. I would like to add one more small thing there, sir. Because we have been talking about COVID, we have been fresh out of it, and again with some scare coming from China, with some kind of a pneumonia, we don't know where we stand. Right, so the phenomenal use of QR code in the Indian healthcare system has actually started only during COVID-19. I was lucky, unlucky, whatever I put it across. I was working with ACIES when we had this pandemic, and my boss trusted me with the responsibility of starting telemedicine on the third day of lockdown when it was delivered. Imagine, third day of lockdown, you've got about 6-7 laptops available to you. That is all that you have. Apart from that, there's nothing which is available. Then the remdesivir picture, thing came into the mind. So we started trying to figure out, because we were facing a huge influx of people outside our hospital waiting to collect remdesivir. Then, it was becoming almost impossible. Like, you have a crowd of 1,000, 1,700 people waiting outside, waiting to get in, and they don't know how much stock is there. So we devised that every end of the day, what we will do is, we will put out a social media post saying that these many vials of the medication is available, and in case you want them, rather than queuing up at the hospital, you fill up a form, which is again a QR-based form. You fill up a form, upload your Aadhaar card and the prescription. And we used to give a tentative time that, okay, that time would obviously could vary, but at least a person is not standing from 4 o'clock in the morning when they know that their time is expected to be around 1:30. So this was a small innovation which we tried to do, and I'm sure it did help, not too many people, but it did help many families, not, who were waiting in the sun at that point in time. So these are small things which you have to think about how you are going to benefit two people, sometimes not monetarily, as Sir mentioned.
Very much. Last two questions to our panelists, and then we open to the audience for question answer, because that is more interesting. Santoshji, tell us a little bit about how technology can leverage rural healthcare, because most of India still is in rural and semi-urban areas where access to physical doctor or hospital is not so easy. So how can technology help, and give us some examples?
So as Dr. Harsh just mentioned about the portable handheld X-ray, primary healthcare centers and community healthcare centers network is already there. But in the absence of basic diagnostic facility, be it radiology, be it pathology facilities, in the absence of these basic facilities, these centers are not working up to the mark or not able to provide those healthcare services which they are meant to be. But with the help of the innovation, with the help of these portable machines like portable X-ray combined with the AI, without the need of a full-time radiologist, we can screen and triage the patients. Suspected cases can be screened out, and we can decide who are the patients who should be isolated or should be sent for the tertiary care, secondary care. In the absence of these basic diagnostic facilities, the contaminated patients are traveling across the village or society, and they are spreading. So we have to enable the already existing centers, we can enable them with the help of innovation. If we try to develop the same tertiary care hospital, the big infrastructure, that won't be possible, because that will take a lot of time and money investment. With the help of innovative technologies, be it the kit-based testing, be it the AI integration with the existing technology. We can make the existing centers capable, and we can utilize them in a more efficient way, and the less critical cases can be addressed at the primary center, whereas the cases which are critical, which are in the advanced stage, can be timely addressed to the secondary care centers and tertiary care centers. So the need is that innovation should be done in a way that it reaches to the villages without the need of full-time healthcare professionals. With the help of technology, the information exchange should happen on the real-time basis, and with the help of all this provision, we can take more out of the existing healthcare setup. So that's the idea. Like for example, the government is running tuberculosis elimination program. They have a goal of eliminating the tuberculosis by 2025. But the challenge is that the last mile connectivity is screening the people in the villages where basic facilities are not available. And doesn't matter how much you spend, you cannot send a conventional X-ray machine for the screening to the last mile. But it is possible if you innovate, if you adopt the portable technology which can reach on the shoulders of the healthcare workers to the last mile. This goal can be achieved. And ICMR has recently started adopting and piloting this kind of initiatives. The need is that we adopt, we invest, we believe in this technology, and definitely we can achieve more with the help of innovation rather than waiting that the same level of development which is there in the cities will reach to the villages and we will be able to bridge this gap. So innovation can be that bridge, sir, which can actually achieve more by investing less.
Now, lastly, I will come to Dr. Harsh. You talked about digital technology and AI, but what do you think are barriers to widespread acceptance of this digital technology, AI and other tools in current healthcare system?
So, most of the tools that are being considered in the digital health or in the innovations, we need to look at the different perspectives. Let's go back to the basics that we consider the healthcare as available, accessible, affordable and equitable. So unless the product or the instrument or the digital tool do not address those four areas, they won't be considered as a disruptive innovations. So those companies who are producing products on the AI, on the innovations, on the other aspects, they are not perceiving these messages at up to the level. They are started, but still the advocacy needs to be raised at certain level. I've seen some of the AI microscope, AI 100 microscope. There are other AI microscopes are there. They can give you the pathology readings. But when I asked about the cost of one AI microscope, it was around 3 lakhs. And they wanted to create a mechanism that each AI microscope can reach the CHC centers. So unless they make the accessible and affordable technology, it will take so much time to reach at certain levels. Same goes for the barriers when we talk about AI barriers. So now coming to the students, how many of you have heard about the different imaging AI technology? Very few. I talked about 6, sir talked about 7, but students might have heard about only ChatGPT or other AI softwares that are being used frequently. The main issue of AI is the validation, and that's the barrier for accepting at a certain level. When we talk about the innovation in the digital health, the ROC curve, the sensitivity, specificity, positive predictive value, negative predictive value to identify negative from negative, to confirm the negatives that they are the normal ones, So the QRI, the DipTech, those are started working around those aspects. कि भाई पेशेंट है तो पेशेंट डायग्नोस करे, पर नहीं है उसको भी डायग्नोस नहीं करना चाहिए कि पेशेंट है. So that's the second thing, that validation needs to be established, and still it's a barrier in the Indian context because we do not promote research as such as. Third thing is acceptance. अभी मैंने एक सेशन लिया था दिल्ली to the teachers about how to do a literature review through the help of Bard, Google Bard, Perplexity and ChatGPT. And they were the teachers, they were frightened. कि यार इतना सब कुछ स्टूडेंट सीख लेंगे तो क्या होगा. और जब मैं एक अलग ग्रुप को पढ़ा रहा था स्टूडेंट्स को, तो उसमें से out of 50% students were knowing how to use these all AI platforms. So the perception and acceptance of AI needs to be keep in open mind. एक चीज है, AI कभी ह्यूमन को रिप्लेस नहीं करेगा, but human needs to be more intellectual and intelligent in coming years. And those who feel कि AI will replace, तो मोबाइल ने भी रिप्लेस कर ही लिया लाइफ को. So if we consider in those aspects, you also need to keep in open mind कि भाई अब यही जनरेशन है, यही फ्यूचर है. So these are the barriers, but in a last nutshell, I would say these barriers are not bigger barriers unless we work towards those aspects. Thank you, sir.
So now we get into the question answer from the audience. Feel free to ask. Don't think anything is a dumb question. Every question is a smart question. So please, whatever you are thinking, feeling out of these discussions, feel free to just ask, challenge actually. You should challenge the panel. Thank you.
On, we can hear you. Speak like an artist, they speak like this, closer to the mic.
Okay, thank you so much, Arun ma'am. We had so much learning from this. So whenever we think about the startup, innovation of any technology or any product, something, so we always look at the target audience, we always hit the wrong target audience. I mean, how should we identify the target audience of our product or technology? Of course, there's market research and other process, but sometimes we do fail in that also. So how do we cater a right product to a right consumer whenever we in the market? So how can we, what other things we should look for, and how can we see it in the larger area?
Okay, so let me answer this question. So all of us know that 1.4 billion population in India. Okay? So 140 crores. Do you know, and we say 70% Indians rural. Imagine 100 crores living in rural areas, no access to good quality doctors, nurses, paramedics. It's a known fact, nothing hidden. So market is huge, target population is huge. Unfortunately, we have no ways as on date in 2023 to serve those population. We are still struggling, trying different methods. I'll give you an example. When I was a student, we have done a lot of research since then. Why doctors, nurses, technicians not going to the rural areas? Government applied all strategies. When I say government, in India, as you know, it's not one government. Each state is the health is a state subject. Each state has their own. I'm not talking about Gujarat, by the way. It's the whole country. So the point is, even today, no answer. They tried all methods. They started a policy that doctors who are studying in government medical college has to serve in rural areas. Otherwise, penalty. Doctor said, we'll pay the penalty, please let us go. Then they said incentive. Doctors will serve in rural areas, double salary. That also didn't work. So all strategies have been tried. Now, the only solution is technology. If technology, uncle, can help, which means So AI, you heard a lot about AI. Actually, AI is a very nascent stage in our country, very, very basic. We have not touched the tip of the iceberg in AI. So what AI would do, in my analysis, is early detection, early identification, early suspicion of cases. That's it. And tell the patient, please go to the hospital. So what will happen by doing that? Catastrophic illnesses, expenses by the families, by the government, both will be reduced a lot. And fortunately, our government is so smart, the Indian government, as students you must be studying about that, how sub-centers are getting converted to health and wellness centers. And that's a beautiful concept. For hundreds of years, when Sir was studying and I was studying, sub-center, 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 2 ANMs, that's it. Today, health and wellness centers are getting converted to beautiful preventive centers with literally 7, 8, 10 staff, with a community health officer, like a manager. So that's where, once the prevention happens, a lot of our issues will be sorted out in the rural population. Prevention is the key. The burden to the health system will be reduced. And hopefully, technology will come to aid. And that's your target population. Do all kind of innovations in that rural population. Thank you.
Any other from the panel want to answer? Yeah. I'll come to you at that corner. Yeah. Harsh.
Hello. So, let me give you our examples. I have been involved in 3 products. One is purely on AI, second is mixed of AI. So, the Niksha Sindhu app, when we once developed, we had almost that's the baseline assessment of 1500, 2000 TB patients and interview of almost 500 healthcare workers with the help of Priya, Yash and other my team members. At that time, first product जो बना, वो first product बहुत ही vague था. The only thing we could learn when we did the collaboration and partnerships. So when we go for any product development or anything you would like to invent or anything you would like to describe in a certain way, the target audience आप जो भी सोचते हो ना उसका perspective बहुत टनल होता है. So go for the partnership, go for the collaboration. So when we involve World Health people, when we involve UNICEF people, when we involve state people, तो 14 states के लोगों को इकट्ठा किया और उनसे पूछा कि सर आप क्या बोलते हो, कैसे करना है. हमने आशा तक गए और उनसे पूछा कि what do you want, and that way almost 150 versions were developed. And when we moved to the Play Store, Google Play Store or iOS Store, 200 versions were passed out. So during the 100 version we learned that if we want to go in the perfection, we need a partnership and collaboration. तो अभी जितने भी students बैठे हैं, if you want to grow, develop your network. आपके seniors हैं, आपके peers हैं, आपके कोई experts हैं, the experts panel who is coming here, get your network, bigger your network, और तभी आपका perspective widen होगा. If you have perspective in a single way, you will feel कि मैं जो बोल रहा हूँ सही है. And secondly, be receptive. Whatever the criticism, whatever the feedback you get, be receptive. So these 2 things will help you to understand your target audience in a many other ways.
We move to the next question. And yeah.
First of all, I would like to thank the entire panel member for a very enriching and informative session. So my question is that as we in the medical world are moving towards digitalization, a large chunk of our proportion is still does not have the access to internet or the information about how it can help in the medical field. So there is a digital divide. So how as we healthcare professionals can work and bridge that digital divide?
So the question is, how do we end the digital divide? There are many people still away from the digital world. How do we reach them?
what you mentioned is correct. Like, still the teledensity in our country is increasing. In fact, we happen to be amongst the cheapest, like in terms of data cost, we are probably at the lower band across the world. Definitely there are things which are happening in the private sector where there is a lot of promotion which is there for the digital divide to end. Unfortunate my part is it's being used for the wronger purpose. It is existing, but rather than knowledge, our knowledge sources have been limited to WhatsApp, Instagram and YouTube. Apparently we have not been able to grow beyond that. So I definitely agree to what you say, but there is a disagreement here as well, that there should be a utilization of the bandwidth that you are getting. Now in Africa, what has happened is, for certain applications, your mobile service provider, this I'm talking about Tanzania because I was working with a few firms there. So if you are doing, they have a hospital called as Muhimbili Orthopedic Institution. So they have a trauma unit wherein they wanted to run, this was a pilot which they were doing, wherein they wanted to carry out teleconsultations using the normal phone because that is all that is available there. So what the telecom companies there, they decided that in certain areas they would allow a specific application to run even if you do not have any credit or any charge available with you. So these are the things which can be looked into. Definitely it is not very easy, and what I'm talking about to you was just a pilot done by a private company there. But yes, on similar grounds, I'm sure there is a lot of innovation which is possible. But yes, that only comes at the cost of a restraint, wherein we need to understand that we do not misuse what is made available to us. So I think as a country, that's a time we need to really wake up and understand.
If you, yeah.
Yes, I'd like to add something to this. So the challenge that you mentioned, during the discussion, some of the panelists mentioned that the first step is you should understand what the challenge is, because that is the starting of the innovation. When you know the problem statement, then you would like to think how to address it. For example, when the ultra-portable handheld X-ray was being innovated, it was thought that when we will be using it in the villages, there will be no electricity supply available. So it was designed in a way that it will be operated on a battery. Electricity supply won't be required because it was supposed to travel to the villages, so its weight was kept quite low. And because it was supposed to be used in the open area, so radiation was taken care. So here your question is that because we are talking about the digital thing and network is a problem or internet availability is a problem. So this problem statement itself says that you have to work on the offline models available. For example, the AI which is working for detecting the tuberculosis, there's offline, online, both kind of models are available. So going forward, you can work on the models which may be installed like an app in your mobile. I mean, imagine as big you can, and then you can end up finding a solution. So already offline tuberculosis AI is already available. You don't need the internet for that. So that kind of innovation can be done, and I think this gives you a lead, gives you a prompt that you should start thinking in that direction where electricity supply or strong network is not required. Thank you so much.
Okay, we have, yeah, Madam, something, we are 20 minutes over time, so we will close with this last question. Yeah.
So I just wanted to add an example around the digital divide that was talked about. So there are a lot of beautiful innovations happening around this aspect. So I'll talk about Karma Primary Care, which is based out of Rajasthan, right? And they are doing very beautiful job for the last 4 to 5 years around redefining primary care. What they do is they have their own primary care center and a teleconsultation clinic as well. And very, like every 10 to 15 kilometers, they have one such center. Now what happens in villages is how they have marketed themselves is very interesting to notice. Any person who goes to a normal medical store to buy some medicine, the pharmacist or whoever is sitting at the store will ask that person, possibly patient or the relative of the patient, that kya hua hai, what's your problem, a normal cough and cold or whatever. There's this e-clinic here, it's very nice, you just go and visit there, right? Once that patient now goes to the clinic, the support staff will help them install the required app, will guide them that if you want teleconsultation service, how it can be done, and will as well diagnose during that time at the clinic as well, right? And how it happens is, now with the spread of the word, most of the villages and the people over there are getting treated with that and are very satisfied, especially the female community, right? Because a lot of female in Rajasthan, they say or they were saying that they could not, just easily walk out of their homes and even go to hospital, right? But this telemedicine, just contacting a doctor for 2 minutes or maybe calling a doctor for 2 minutes helped them immensely. So I agree to some extent that digital divide is there, but I would also like to say that smartphones have already penetrated now each and every household of India, and a lot of people can think around how to maybe trigger that person to use that, because as sir rightly mentioned that people are not using maybe it in the right manner and for other reasons and not for the other reasons. So if they start using it and adopting it for health reasons, there is a lot of value that they can derive from it.
So we are at the end of the session. A lot of inputs, knowledge, but for students, there should be some takeaways. What you can do tomorrow, literally from tomorrow. So one is, when I was a student, actually, I'll tell you very interesting. All this tech was not there. But there was this, I'm sure you all know, Health Technology Assessment International, HTA International, there is an organization, okay? So when I was a student, I used to very aggressively apply for those abstract submission and all that. When your abstract gets selected, you get sponsorship to travel to that country, to present your paper and all that. So you must do that. And then your institute here in Gujarat is probably one of the best HTA centers. So all of you should try that. Take these technologies, ideas, create a Jugaad abstract. As a student, you can do much own research-based abstract, but at least a Jugaad abstract, which I used to do. And then very interestingly, I also created the kind of pathway. So somebody said only HTA can happen with the products. I said no. So I found out from the dictionary, there is a definition which says technology refers to methods, systems, and devices. Devices comes third. So on the method side also you can create HTA. On the system side also you can create HTA. So what I did is, wherever I was working as an intern or whatever, initial stages of employment, so methods and systems is in your control. You may not have devised a device. So use that to apply your abstract and get selected into all these conferences and travel. So that by doing that, you gain a lot of knowledge, a lot of insights, like you are gaining from the conference. And that is how you develop to a innovative healthcare professional. So with this, I'll conclude my questions. Thank you. Thank you.
I thank all the panelists and the chair and hand over back to the organizers to close the session. Thank you very much for a patient hearing and interesting questions. The panel are here after the session because time is over. You can ask them individually, meet them.
We hope you all enjoyed and learned something new and useful from this session. Thank you for joining us. We are extremely grateful to all our panelists and for imparting their valuable knowledge. Now I would like to request Dr. Meena Wadhwa to felicitate Dr. K.T. Pradhan Bhushan. I would like to request Dr. Apurva Pandya to felicitate Professor Dilip Mavlankar.
I would like to request Dr. Kirti to felicitate Ms. Ritu Balia.
Next, I would like to request Professor Mavlankar sir to felicitate Mr. Himanshu Sharma. Next, I would like to request Dr. Kirti Pradhan to felicitate Dr. Harsh Shah. Next, I would like to request Professor Mavlankar sir to felicitate Mr. Santosh Kumar. Thank you everyone. Let's have a big round of applause for all the panelists present here. I hope this panel discussion has left you with positive influence and encouraged you enough to take your hands on innovation. I, Priyanka Bish,
And I, Vristi Pandya,
is signing out for today. We wish you all the success, a bright future, and after this panel discussion, I would add more patents ahead. So there are two more important announcements. Those who have participated in poster presentation, stay back in the amphitheater. And those who are participating in the marathon, kindly collect your t-shirts from reception area. And the marathon will start sharp at 5:30 p.m. Thank you everyone.
हाँ रिकॉर्ड करो ना